Deep vein thrombosis prevention. Deep vein thrombosis is the formation of a blood clot in a deep vein, usually affecting the lower extremities. DVT formations are influenced by elements in Virchow's triad: stasis of blood, increased blood coagulability, and vessel injury. The most prevalent cases are in immobile patients and those with spinal cord injuries. Some other risk factors include stress, trauma, and pregnancy, which could lead to hyperreactivity of blood coagulation. Indwelling venous catheters and surgery are the most common causes of vascular trauma.
DVTs have many complications, which include lower extremity pain, skin ulcers which could lead to infection, edema, and varicose veins. More serious complications include MI and stroke. The most significant complication of DVTs is pulmonary embolisms. If left untreated, it can cause death. It is reported that around 15% of all hospitalized patients are affected by DVTs each year. This increasing rate indicates how important education and prevention is.
As nursing students taking care of medical surgical patients, we, the Humpback Dolphins, decided to conduct research on how to prevent the DVTs. We questioned the efficacy of prophylactic use of compression stockings and sequential compression devices to prevent DVTs in patients with high-risk factors.
Prevention always comes first. Methods of prevention include anticoagulant therapy, mobility, flexion and extension exercises, and mechanical methods.
Sequential compression devices. SCDs consist of plastic sleeves with a number of compartments and a pump. These plastic sleeves are applied to the legs. The pump inflates and deflates the compartments in a predetermined time sequence. This applies pressure to the muscles of the legs and a corresponding sequential compression to the veins of the legs. This process mimics the action of walking and promotes venous return toward the heart and prevents pooling of blood in the lower limbs. According to a study, SCDs are relatively comfortable to wear and do not restrict movement in the legs.
Graduated compression stockings, on the other hand, are specialized long socks which are worn from the foot to the knee or thigh. They are made of strong elastic material and fit securely at the feet and gradually become less tight at the knee or thigh.
According to UCSF protocol for sequential compression devices, they need to be applied 8 to 12 hours preoperatively. They should be used until the patient is able to ambulate. UCSF's protocol acknowledges when surgical patients are at high risk for DVT, when sequential compression devices should be used, and the contraindications for use.
To reiterate the information from the video, CPMC protocol emphasizes the proper sizing and application of compression stockings. Contraindications are listed on.
Review of the evidence number 1. The purpose of Kelperet's Level 1 meta-analysis paper is to report current evidence-based guidelines in the prevention of DVTs and to raise awareness of early prophylaxis. Measures in preventing DVT in medical, surgical, and lower extremity orthopedic patients were explored through large meta-analysis. Questions exploring the risk factors, statistics regarding lack of prevention, and the rates of incidence are explored. DVT affects 2 million people in the U.S. each year. The incidence of hospitalized patients is 15%. According to a registry tracking the incidence of DVT, 71% of medical and surgical patients who were diagnosed with the DVT had not received any DVT prophylaxis 30 days prior to diagnosis. A prospective registry of patients found that surgical patients received DVT prophylaxis 66% of the time, where non-surgical medical patients were given prophylaxis only 23% of the time, even in the presence of known risk factors. The paper explores risk factors, listing them as decreased mobility, obesity, estrogen therapy, age, surgery, CVC, previous history of DVT, and certain medical conditions. These conditions include cancer, inflammatory diseases, acute infections, heart failure, stroke, and chronic lung disease.
Multiple risk factors such as decreased mobility, acute and chronic diseases, plus the presence of a CVC, which can cause injury to the venous system, one of the elements of Virchow's triad, result in a synergistic effect of even greater risk.
Review of evidence number 2. The second article, also a meta-analysis level 1 evidence paper, had the purpose of objectively analyzing the physiological effects of mechanical methods on venous flow in the effort to reduce DVTs. Results state that all major intermittent compression methods successfully empty the deep veins and prevent stasis. Their method of action is that they squeeze blood from the deep veins, which is then displaced proximately, assuming the valves are patent. When they deflate, blood refills the deep veins. The paper concluded that all methods and types of intermittent compression methods do work to prevent thrombosis. Even simple devices can be beneficial. The only concern and disadvantage over pharmaceutical methods is proper application and patient compliance. The article states that the method of action of graduated compression stockings is unclear, but there is a growing consensus that there are an effective prophylaxis involved. The hypothesis of how they work is that they prevent venous dilation and distension. Velocity of blood is dependent on the cross-sectional diameter of the vein. Mechanically preventing larger vein diameter will increase velocity, thus preventing blood pooling and stasis.
The article describes the major drawbacks of stockings is improper fitting. Studies have shown that up to 98% of calf-length stockings were not producing the pressure gradient intended by the manufacturer. Even more worrying, the majority of both calf and thigh length were applied to patients in such a way that they were causing reverse gradients. That is, when the proximal area of the calf had higher pressure gradient. This tourniquet effect could cause ischemia and in fact cause, not prevent, thrombosis. In summary, this meta-analysis found that stockings have positive efficacy in prophylaxis even though the hemodynamics remain unclear. They may not be as effective as intermittent compression devices or pharmaceutical methods, but because of their cost effectiveness and availability, their use, especially combined with other methods, can be an effective tool to prevent DVT. It is vital that they are fitted properly so pressure is not higher on the proximal end. They can be worn under intermittent compression devices since each has a different method of action. The stockings prevent distension while intermittent compression devices empty the veins.